Hello and welcome to the two-page cheat sheet for the NRCME, presented by the DSG team, or the DOT Study Guide team. Now let's get started with the two-page cheat sheet for the NRCME. Here we go. A CMV, or a commercial motor vehicle, is defined as having a gross weight of greater than 10,001 pounds. So anything greater than 10K pounds is a CMV. Or if there are 9 to 15 passengers, including the driver, for compensation. So if there's compensation involved and 9 to 15 passengers, that's including the driver, that is a CMV, a commercial motor vehicle. 16 passengers, including the driver, defines a commercial motor vehicle regardless of compensation. And finally, if the vehicle is transporting hazardous materials in quantities that require placarding, that require a placard about the hazardous materials, that is a CMV, or commercial motor vehicle. Medical examiners are to examine for medical fitness for duty. They are not treating these conditions, okay? You can help the patient get certain conditions treated, helping as far as referring them back to their primary care provider, or making referrals to specialists as needed, but you yourself cannot treat the patient during this exam. You wear a special hat, essentially, and that's the medical examiner hat. And you are essentially a judge. You're deciding, does this driver have the qualifications enough to be certified or not? And that's the primary basis of your role in this situation. Now, medical examiners cannot add limitations or exceptions for drivers. You have to follow the guidelines, and that's what we'll be learning today. Now, if further information is needed about the driver's condition, there can be a continuation of your evaluation, and this does not require another full exam. As you've probably learned in your training course, there is a date that you use, and that is the medical exam date. And then you work within a 45-day window after that. And your expiration dates will be based on that examination date, not the date that you finally sign off on the medical examiner certificate and report. That's very important. So if you give them 3 months, or 6 months, or 2 years, whatever the time frame, that is from the date of the medical exam, not necessarily from the date that you sign those documents. All right, you'll be giving one copy of the medical examiner certificate to the driver and another to the employer. The certificate goes to the driver and the employer. The licensed physician responsible for receiving lab results and evaluating any explanations for those drug results is the MRO, or the Medical Review Officer. That's a separate person, separate hat. The CMV driver must be 21 years old, speak and read English well enough to converse with the general public, and have a valid medical examiner's certificate, which you will be filling out and signing. There are 4 non-discretionary standards. In other words, there are 4 elements that are essentially black and white. And the guidelines are there for everything else, but these 4 must be adhered to. Those 4 are vision, hearing, diabetes, and epilepsy. Vision, hearing, diabetes, and epilepsy. Vision includes 3 major things. You've got visual acuity, and that's a vision greater than 20/40 each eye. Now, we would talk about this further in the exam walkthrough, but I just want to mention one more time here that one eye can pass. Monocular vision can pass only with a vision exemption, a federal vision exemption. Otherwise, both eyes greater than 20/40. Additionally, with vision, peripheral vision should have a field of vision greater than 70 degrees each eye. Field of vision greater than 70 degrees each eye. And finally, with vision, color vision. The patient should be able to see and distinguish red, amber, and green. The patient does not need to have the ability to distinguish any other colors beyond that. They have to distinguish red, amber, or yellow, and green. All right, after vision, the next non-discretionary standard is hearing. The patient will undergo either a forced whisper test, 5-foot distance or greater, or audiometric testing. The audiometric testing is being able to hear greater than 40 decibels at 500, 1000, and 2000 hertz. This is regardless of hearing aid use, whether the forced whisper test is used or the audiometric testing is used. So regardless of hearing aid use. Now it is recommended that a driver carry a spare hearing aid battery as part of their work. And at least one ear must pass. If the driver has diabetes, the third non-discretionary standard, if this diabetes requires insulin, the driver is disqualified. Now, there is a federal exemption for diabetes as well. So there is a federal exemption for monocular vision, and that's why I mentioned it earlier. And there is a federal exemption for diabetes, such as diabetes requiring insulin. The fourth and final non-discretionary standard is epilepsy, which is disqualifying. Now let's talk about exemptions a little more. An exemption is valid for 2 years with an annual medical and specialist examination. So you will have the driver undergo medical and specialist examinations every single year, and your maximum certification will be 1 year. But this exemption will be good for 2 years, so that they do not have to go through the exemption process every single year. They get a break every other year. It is recommended that drivers avoid driving less than 12 hours after taking any sedating medications. If they've taken a sedating medication, they should wait at least 12 hours. If the driver has an ICD implant, an internal defibrillator, even if that defibrillator is inactivated or turned off, the driver is disqualified. Regarding blood pressure, a blood pressure greater than 139/89, essentially 140/90, must be confirmed with a second measurement later on in the exam. If there's a blood pressure greater than 140/90, you must confirm with a second blood pressure reading later on in the exam. Let's discuss the stages of hypertension. This can get very confusing, especially in an audio format such as this, so I strongly recommend that you look at the written out information on the NRCME website, the FMCSA website about the NRCME. The 2-page cheat sheet that we provide with this audio, or our full exam walkthrough product. Let's talk about the stages of hypertension. If the systolic and diastolic blood pressures are at different stages, you must classify by the higher stage. If there is a difference, if the systolic and diastolic blood pressures are in different stages, use the higher stage to classify. If there is no hypertension, you can give a 2-year maximum certification. Defining hypertension: if one or more antihypertensive medicine is used for the purpose of controlling high blood pressure, then that patient is diagnosed with hypertension. Stage 1 of hypertension, 140 to 159. I'll make it simple and just round up the numbers, but know that these are exact numbers. So 140 to 160 over 90 to 100 is stage 1. Probably the easiest way to think of this is that the systolic has a 20-point range and the diastolic has a 10-point range. One more time. Stage 1, 140 to 160 over 90 to 100. There's an expiration of 1 year. So a maximum recertification of 1 year. Recertification is if the blood pressure is less than 140/90. If the blood pressure is greater than 140/90, you do a one-time certification for 3 months, and we'll discuss this further in the exam walkthrough. Stage 2, 160 to 180 over 100 to 110. Stage 2 is 160 to 180 over 100 to 110. You will do a one-time certification for 3 months. The recertification is 1 year from the date of exam if their blood pressure. We have a bigger, fuller product called the Exam Walkthrough, the NRCME Exam Walkthrough, which has much more material that we discuss, again, in very concise and easy to understand information. And we provide an audio companion, just like we did for this 2-page cheat sheet. We provide an audio companion for the 10-page exam walkthrough. We also provide, as a bonus, audio companions for what the exam day is like and how to prepare information products. And we provide an audio companion for the review questions, over 120 review questions to help you prepare for the exam. So if you're interested in any of this material, please check out our website and purchase our products in order to help you do better on the NRCME exam and in order to help you do better with your clinical practice in doing these DOT medical examinations. On behalf of the DSG team or the DOT Study Guide team, thanks for listening. Have a great day. Good luck.